Tonight on KQED Newsroom, as protests continue, we consider the impact of everyday and often unconscious racism in our institutions, our relationships, and at work. Also, easing restrictions on restaurants and retailers in San Francisco. We'll discuss the obstacles and opportunities shaping economic recovery. Plus, schools get guidance on how to reopen in the fall, but will students and parents feel safe? I'm Priya David Clemens. Hello and welcome to KQED Newsroom. In the midst of a health crisis and a recession, we as a nation are reckoning right now with the racist choices of our past and the racist systems of our present. Even those of us who think, I'm not racist, often contribute to a culture that has been steeped in inequity. Tonight, we're going to consider the presence of racism in the fabric of our lives, not as individual acts of discrimination, but as a social force, one that has brought us to this particular point in history. Joining me now by Skype is Stanford University Assistant Professor of Psychology, Stephen Roberts. Professor Roberts, thank you for joining us.
Thank you.
Professor Roberts, many of us, myself included, would say we're not racist. But you say our common use of the term racism is too narrow. How do you and other academics define racism?
We define racism as a system of advantage based on race. I think we commonly think of racism as mistreating or disliking others because of the color of their skin. But we define racism as a system, as a hierarchy, as a pandemic that we are all embedded in.
You recently authored a paper along with a white colleague in which you outline 7 factors which contribute to American racism. We won't be able to get into all of them, but could you list them for us and then we'll talk about a couple in detail?
Sure, yeah, my colleague and I, Michael Rizzo, we listed these 7 factors. There were many to choose from, to be clear, but we spoke about categories, factions, segregation, hierarchy and power, media, and passivism. That's 7 factors.
Let's take that last one first, passivism. What does that mean?
Well, it means that, to be clear, to set the stage, that we live in a nation that has been plagued by racial hierarchy since its inception. We live in a very racist country, but we often don't do anything about it. We're often passive. We sit idly by and let these hierarchies remain in place. And that's, in fact, where I think one of the biggest problems is that we need to stop being passive and we need to actively try to be more anti-racist.
I want to also dive into this question of factions. What does that mean? It sounds like you're talking about different groups maybe against each other, but a lot of people wouldn't feel that they are that way in their regular lives.
Yeah, that's how people often feel. But let me walk you through a quick classic psychology experiment. You take 4-year-olds into a lab and you flip a coin and randomly assign them to groups. Right after being assigned to those groups, they think that their group is like a team, like a coalition, that they have to trust their group members, they have to support their group members, that they can't trust out-group members. Now, after a lifetime of being in a racial category, we are in many ways conditioned to treat those groups as if they were those coalitions. It's a basic psychological phenomenon.
How do you move out of that?
That's a tough question. Now, the factions, the groups in and of themselves aren't necessarily bad. People get a lot of great meaning and culture and identity out of their in-group membership, and that's great in many ways. But once those factions or those teams, once that factor gets coupled with other things like hierarchy, who's high status, media, how does the media portray your group? All those factors combined together make this problem. So I don't think that any of the one single factors, removing them, would be the solution. There's this broader system that we need to grapple with.
And you use the terms proactive and reactive anti-racism. What do those look like in everyday situations?
I think one clear piece of evidence for reactive anti-racism is what we've been seeing a lot in the last few weeks. People are protesting, they're taking to the streets, they're fed up by the horrific events that have happened recently. So people are reacting to that and choosing now to be anti-racist. Now, proactive anti-racism, I think, would be taking that momentum, taking those reactions, the feelings that many of us have, and implementing them into some kind of long-lasting, future-oriented change. Let's make sure that we don't end up here again. How can we be proactive to save our future, so to speak?
Do you see an action that should be taken right now that is proactive that you would advocate for?
I think it's a great question and a tough one. I think that we can be, proactive in many ways. One of the ways I think that's probably, most important as a developmental and a social psychologists is parents can be proactive in having explicit conversations with your children about race and racism. There's a lot of research showing that white parents often do not talk to their kids about race and racism, and that sets those kids up to not have an understanding of those things later on. But if we instill a standard of anti-racism with children, these are going to be the future leaders of future generations. If we create that norm now, hopefully we'll have a proactive anti-racist society going forward.
You write that we are in a time of, quote, increasing racial inequality. But aren't the protests and the changes in the law that have occurred over the past few decades evidence that America is moving toward equality?
Yeah, I think there's a lot of social scientific data to make clear that that's unfortunately not the case. Economic inequality between white and African Americans is increasing. Residential segregation across micro and macro levels is increasing across the nation. Now, on the surface, it may seem like we're progressing toward a post-racial society, but the actual data suggests that we're in many ways going back. Now, this doesn't mean that everything is bad. There's a lot of good that has come, but we're definitely far removed from a equal society.
You also point to media as one of the 7 factors which influence American racism. How does the media perpetuate racism?
Yeah, I'll give one concrete example of which, again, there are many to choose from, but there's data from communication studies showing that if you compare how often the media portrays white people and black people as criminals or victims compared to actual crime reports, black people are overrepresented as criminals and underrepresented as victims. And in contrast, white Americans are overrepresented as victims and underrepresented as criminals. And these kinds of distorted images affect our psyche and the things that we learn and how we think society actually is structured.
In recent days, we've seen some examples of how sports and entertainment worlds are taking action to redress some racial wrongs. So NASCAR has said we're not going to be displaying Confederate flags any longer at races. The NFL commissioner has said it was wrong to discourage players from taking a knee. How do these kinds of actions by popular organizations impact a public perception of racism in society?
I think they have a huge impact, and I think that they're very important and great. First of all, they're great instances of proactive anti-racism. Let's put political structural change in place so that we don't end up here again. But I also think that the more examples we see of that, the better our society will be served in the long run. Now, in the paper, we talk about the importance of power, that if people in positions of power set a norm and set a standard, that the people who follow them will follow. So I think the more people we have who take that stand to be proactively anti-racist, especially if you're in a privileged, powerful position, will pay dividends in the long run.
Professor Roberts, what would a post-racial America look like? I mean, is that even possible, or is it a utopian pipe dream?
I think it's not necessarily a pipe dream. I think racism and racial hierarchy is so deeply woven into the fabric of U.S. society that if we want to be in a post-racial society, we really need to rethink what the structure of our nation will look like. I do think that the ideal U.S. society for me would be one in which one's race does not determine one's place, or what your race does not determine your position. And all the data show that based on the color of your skin and your racial identity, your life chances and your life opportunities are deeply affected. And I think that's an injustice. And I hope that we all move toward a nation in which that's no longer the case.
Professor Stephen Roberts with Stanford University, thank you for your time.
Thank you.
This week, San Francisco Mayor London Breed announced that restaurants in the city could reopen starting today for outdoor dining. And on Monday, San Francisco retailers will be allowed to reopen for indoor shopping for the first time in 3 months. The city is also providing free temporary permits to allow businesses to use public areas like sidewalks and parking spaces for outdoor dining and shopping. Joining me now by Skype from San Francisco is Jay Cheng, the Public Policy Director of the San Francisco Chamber of Commerce. And also with us by Skype from Alameda is Jeremy Owens, the San Francisco Bureau Chief and Tech Editor for MarketWatch. Hello, and thank you for being with us.
Thanks for having
us.
Jay, let's start with you. What are you hearing about restaurants opening to patrons now in their outdoor seating areas? How helpful is this to them?
We have a lot of restaurant owners that are very excited to reopen for outdoor dining, but there are a lot of challenges that they're facing with this model. For one, it's summer in San Francisco. And so for a lot of folks, it's freezing cold outside. And so there's a question about how many customers are really going to want to do outdoor dining during this time. And that means for restaurant owners, how many seats should they put out? How many waiters should they hire? How many chefs should they bring back? And so this becomes a larger question for the economics. Since March, we've seen an 84% drop in restaurant sales. So even as restaurants have pivoted to takeout or dining or food trucks and been very innovative in how they approach this, the damage to the restaurant industry is incalculable. So I think a lot of folks are excited about outdoor dining as a new expansion for their market, but many challenges still remain.
So maybe it'll help a little. It's certainly not going to take us all the way there. Jeremy, let's talk about tech companies in the Bay Area. How are they weathering this storm? It seems like some have announced layoffs. Others are announcing record highs with earnings.
Yeah, and some at the same time. Right, we see some of them announcing record high revenue and great profit, and then still furloughing people or laying them off. The thing is that it isn't really affecting the Bay Area that much. If you look at the layoffs that have been announced at large tech companies, Uber announced that it was going to lay off 3,700. Fewer than 300 of those were coming from the Bay Area, according to notices with the state that they have to file. Yelp announced 1,000 permanent layoffs and 1,100 temporary layoffs. About 250 of those, I believe, were temporary layoffs in San Francisco, and that was it for the local. And meanwhile, these companies' stocks have resumed record runs. They're back at record highs. Their earnings are at records. Tech is not affected by this, really. And if it's affected by it, it's actually positive.
Interesting. So why do you think that tech has been able to do so much better than other sectors of the economy?
Well, I think it was set up to be remote already. Most of these tech companies already had people working from home at least part of the time. So going remote was not a huge issue for them as it might have been for other industries. And then you also have the fact that it's just set up where they have the people, and all they have to do is kind of cut back on some of the things they were trying to do beyond their core and focus on the core. And that works just fine. And what the CEOs are saying, their big talking point is they've been saying for years that there's going to be this digital transformation all over, that people are going to start working remotely, that we're going to start doing things from wherever. And this is only accelerating it. This might actually be a boost to what they were already looking to do.
Jay, the Chamber of Commerce has put together a playbook for reopening. Could you talk us through some of the highlights?
Yeah, some of the highlights is exactly what Jeremy is talking about. We are pivoting to a work from home environment. Many of these larger employers and tech firms are going to allow or encourage their employees to work from home for the next several months, even next several years. And our neighborhoods don't have the bandwidth to sustain that kind of professional work environment for a very long time. I'm sure many of our viewers already have trouble where both people are trying to sign onto a Zoom at the same time and the entire network crashes. We need to build out more bandwidth in our neighborhoods, allow fiber in more neighborhoods, and close that digital divide. So as people work from home permanently, we are able to sustain that kind of growth.
Jeremy, could you talk about how the changes to consumer spending are going to be impacting the economy long term? What are those consequences?
Well, it's going to be really tough to know until we see us come back, right? There have been completely different consumer behaviors in the last 3 months than what we saw previously. And people are expecting us to go back to the consumer behaviors from 3 months ago. But how much has permanently changed? We don't know until we open these back up. But opening back up and trying to get people to come out and spark this economy anew could spark a second wave that shuts us down again. And all the money is betting on this being over in the next few months and us returning to normal. But we don't know if we're going to return to normal. And if we return anywhere close to normal, we could spark another wave of outbreak that could shut us all down again.
And I want to put a couple numbers out here, Jay, for you to comment on. In the past 3 months, basically since the pandemic started, here in California, 5 million people have filed for unemployment. That's about 26% of the state's workforce. What do these numbers say, particularly now that we are officially in a recession, about the challenges for economic recovery in the Bay Area?
Yeah, absolutely. Those numbers, for one, speak to the growing income inequality that the pandemic has brought. There are many employees who are able to work from home. They tend to be higher paid employees already. There are many employees who are not given the option to work from home. They're restaurant workers, they're hourly workers, they're retail workers. They need to be on site. Those are the unemployment claims that have been filed. And so we're seeing a growing income inequality from this pandemic. That's going to be a huge question for us as we begin the economic recovery. How do we bring those workers back? How do we make them feel confident that they have discretionary income to spend? They're a huge part of our workforce. That's why one of the things that the Chamber is pushing for is opening up large shared commissary kitchens to allow restaurants to pivot to food trucks or delivery or takeout and bring those workers back earlier and allow them to work in a remote site that is safe and sanitary and allows them to come back to work.
Jeremy, what are the signs you're going to be looking for? What are the signals that the market will send that we are in a sustained recovery?
Well, what we'll see is next week we'll get the state unemployment for May, and we'll see exactly how many have come back, right? There was that big jump in the national unemployment or national employment. We actually improved in May unexpectedly. A lot of that was because these workers who had been temporarily laid off in April or even March were getting their PPP payments. It's really a classification thing. So it's going to be tough to even say if those numbers will really show we're back. I think what we need to do is continue to focus on the infection numbers, on the death rate, on the people in hospitals, right? We have not seen that really improve in Alameda County where I am. We have seen it improve in San Francisco County, right? So we need to look at those to see if we're going to be able to come back and really do something, because we're asking people who are already disadvantaged versus the higher class tech workers to come back and service those people. We can't really do that if they're still in danger of getting infected and potentially dying. That's a horrible thing to do. And it's just exacerbating the split we have in this region between the tech workers and the service workers. And we really need to look out for those people and make sure that we're not putting them in danger.
Jay, same question to you. Are there specific metrics you're going to be looking for to say, yes, I believe that this is a point at which we have sustained economic growth, we are in recovery?
Yeah, one of the numbers we look at is how many small businesses in San Francisco, or how many businesses period, are operational and remain operational. I think Jeremy brings up a great point. There are a lot of businesses that are open right now, small businesses that are open but bleeding out cash. And the reason they're open is just to maintain their customer base, maintain their fan loyalty, maintain their brand. But they're bleeding cash and it's not sustainable for them. How long are these businesses going to be able to survive? And if new businesses relaunch, how long are they going to be able to stay in business, or will they get shut down after a second wave of infections or outbreaks? And so we track those daily numbers to see whether an economy is going to be sustainable over the long term.
Jay Cheng, Public Policy Director at the San Francisco Chamber of Commerce. Jeremy Owens, San Francisco Bureau Chief and Tech Editor for MarketWatch. Gentlemen, thank you both so much for joining us today.
Thanks, Priya.
Thanks for having us.
This week, the California Department of Education unveiled guidelines on what school districts should do to prepare for students returning to classes in the fall. Among the recommendations, face coverings worn by teachers at all times, hand washing stations, and of course, social distancing. Students could also alternate attendance for in-person instruction, with other days of the week being reserved for distance learning. But big challenges remain, including concerns about another spike of the pandemic in the fall that could keep kids home once again. Joining me now by Skype from Richmond is KQED Senior Editor of Education and Equity, Julia McAvoy, and Dr. Dan Cooper, a professor of pediatrics at UC Irvine. He joins us by Skype from Irvine. Thank you both for joining us.
Good to be here.
Julia, could you run through what administrators need to accomplish in the next couple of months to get schools ready to reopen in the fall?
Priya, I would say it's pretty challenging. It's a logistical one hurdle after another. Everything from how to get kids to board buses safely in the proper order, to how to have sanitation stations throughout the school, to who's going to take temperatures at the door when they come in and screen them, and how to keep them from removing their masks during the day, who's going to be watching all of this. And then the ultimate question, I think, is, what do we do if a child or a staff member does present ill? How do we isolate them and then make sure they get picked up? And then how do we do contact tracing and testing after that, which, we are really not quite set up robustly enough to take that on. Perhaps by August, when some schools start to reopen, that will be in place. But basically, Priya, it's very detailed. Now, these are not mandates for schools to reopen. These are guidelines. These are suggestions. And each district is told by the state Department of Education basically to work with its local public health department to make sure when is the right time to open and under what exact circumstances they would be allowed to open as well.
And Dr. Cooper, is it realistic to think that teachers and students aren't going to be vectors of the disease, considering how they mingle and how kids play?
It's a really tough question. We don't know the answer to that yet. There's no question that the idea has come up that because children are relatively asymptomatic, that they may have the infection and be carriers. The data suggests so far that may not be the case, but we really haven't seen large-scale studies where the children are back in school. We have seen some studies, for example, from Holland, which demonstrated that the most common transmission pathway is from adult to child, but that was during a period of time in Holland when the shelter-in-place rules were there. So we do know from looking at schools around the world that there are examples of successes, and there have been examples where there have been outbreaks in the schools. We don't know yet whether those outbreaks occurred from the kids to the adults or from the adults to the children. So this is a really important and yet unanswered question.
But you are in favor of sending kids back to school in the fall, despite the risk of infection?
Yes, I think, and we've discussed this among many of my colleagues who are experts in the transmission and experts in both the social and behavioral, that the risk of keeping children at home suggests that you can keep them in a bubble where they'll never interact with anybody. And we know that that's not the case. So my thought is that, at least with the schools and with all the thoughtful work that has gone into it, we have some ability to control interaction. And the fact that the kids themselves are not getting that sick, now there are exceptions, of course, the fact that the kids themselves are not getting that so sick suggests to me that this is probably the most prudent way to go, is to try to reopen the schools carefully and thoughtfully.
Julia, you've been following a fascinating case in Marin where one school district has begun to reopen and bring some students back. How are they doing that?
Yeah, well, it began with the superintendent of the entire county deciding that she wanted to bring small groups of special education students in at 3 different schools and do little pilots with them, classes of no larger than 10 students. Then it went into a school called Bayside Martin Luther King Jr. Academy, which is in between that Sausalito, Marin City area there. And that school has been schooling in person kids, about 27 students now, since around May 20th. And I was there yesterday and I sort of saw how they've done it. And what they do is they have kids being dropped off in different stages. They line up, of course, 6 feet apart. And then they come in through a door. There's a temperature check. They ask the kids if they felt sick the night before. Did they have any diarrhea? Did they have any vomiting? Did they have any temperature? And then they make them wash their hands with the hand sanitizer for 20 seconds. And then on the child goes into the classroom. Inside the classrooms, the desks were spaced apart. The teachers that I saw, 2 of them had masks on. One teacher did not have a mask on. Itoko Garcia, who's the superintendent of that district, told me that the county public health department there said they could have children who were under 12 not wear a mask. But he's trying to make sure that every child does keep their mask on. But the county public health department seems to be indicating that the school has some leeway here, and he's trying to go above and beyond and make sure that it remains as safe as possible. Priya, the reason they did this is because those children, there were about 35 kids that they felt were falling behind. They couldn't find them. They weren't participating. They weren't turning in their homework. And they really felt like these kids were going to fall behind in this situation. And they felt really badly about that. So they said, look, if you're not going to turn your homework in, maybe you'd like to come into school. And then teachers volunteered. Some teachers saw what was going on with these special ed classes, and they said, hey, we know you guys are in there. We'd like to come in, and why don't we hold our virtual classes for everybody in the schoolroom? And then those 5 kids who I know are falling behind in my class, they can join in, and I can in person help them while they're in there, and I'm doing this virtual classroom for everybody else.
And Dr. Cooper, I'd like to get your take on this. Does that sound like a model that could work for other schools? And is there one that's more important than another, say masks versus social distancing?
So let's start with the latter question. I think the social distancing is probably, looking at all the evidence, although there's nothing absolutely firm, I think the social distancing is probably the most important. And for most schools, as Julie pointed out, keeping class size down and manageable and hand washing is very important. Mask wearing, I think the data suggests that it helps. It is really important to not politicize this. Unfortunately, in my own region in Orange County, one of our outstanding healthcare officers actually resigned because Her name and address were put out there because she advocated masks. People gathered at her home, and it was a very frightening and intimidating experience for her. The idea of suggesting that we should do everything we can, and something as simple as using masks is a good idea and should not be politicized. We should try to do it. Younger children have been studied in other epidemics, for example, in influenza. Younger children do have a hard time wearing masks. The downside of wearing masks is that it can sometimes produce the opposite effect. In other words, younger kids touch their face and touch their nose because of the mask. And the whole point of the mask is to keep, one, the droplets from spreading, and two, from keeping your hands away from those droplets. So I agree that this should be individualized.
Julia, can you talk to us about how the pandemic and this question of education and distance learning versus learning at the school has widened the equity gap and the equity question?
Yeah, the pandemic has definitely revealed the digital divide. There are parents who have means, who have educational backgrounds, who can stay home with their kids and supervise their learning, and those kids have computers and they've got internet Wi-Fi that's high speed. Then you've got a lot of parents who can't afford to stay home with their children, who have to go out and go to work. Their children are at home. They may not have a computer. They may also not have Wi-Fi. And those kids are falling behind in the distance learning in many regards. When schools reopen, I think you're going to have parents making the same choices in the same positions, which reveals the inequity of how we're living in this society right now. Parents with means can say, that's too risky for me. I'm not going to send my kid to school just yet. And there's other parents who are going to say, I've got to go to work. Thank God the schools are opening. I'm going to send my kids into school. And the schools may do a fantastic job with these students, and it may be safely implemented. But at the end of the day, those parents are in a position where they don't have much of a choice, I don't think, personally. And if those kids, God forbid, do contract something in school and go home, they end up in families where there may be more people to a household, there may be somebody with an underlying condition, and it's possible that we might see more people of color, in fact, suffering disproportional deaths because of COVID-19 as a result of schools opening up. That's an equity problem.
Julia McAvoy with KQED, Dr. Dan Cooper, University of California, Irvine. Thank you both. You can find more of our coverage at kqed.org/KQED Newsroom. I'm Priya David Clemens. You can reach me through my social media handle, Priya D. Clemens. Thank you for watching. Good night.